Hello friends, in this video I am going to tell you about the first aid that you follow when you experience a nosebleed. Nosebleeds are very common in young children. Sometimes you get it also in adults. In this video I am going to talk about the set of measures that you can follow to prevent nosebleeds, as well as the first aid that you follow when a person is experiencing a nosebleed. First things first, in children the nosebleeds are commonly due to this habit of nose picking. Okay, so make sure your child is not doing this, especially when you're not looking at the child. They get into this habit of nose picking, so make sure your child is not into this habit. So what do you do when the child is having a nosebleed? So stay calm. First you need to get yourself together. Don't panic. So make the child sit in a place, make them bend their head like this, bend it forward, and then put your thumb and index finger like this on the soft part of the nose and apply pressure. So this kind of pressure has to be applied for at least 10 minutes. Do not release this pressure in between to check if the nosebleed is occurring. So you need to hold this pressure constantly for 10 minutes. This is the first point. The second thing is, if they are going to get that bleed into their mouth, if they are going to get the blood in the throat, ask them to spit it out, because swallowing it will irritate the stomach. It will lead to vomiting. So make them spit the blood which comes into the mouth. So most of the time these bleeds are harmless. It is usually due to a small fragile blood vessel that breaks in the front part of the nose. So with this pressure, 80% of the time it should settle down. So this is the first aid that you follow. The next thing that you do is ask the child not to blow the nose. Okay, blowing the nose will aggravate nosebleeds. So at least for 1 or 2 days following a nosebleed, you mustn't force the child to blow the nose. Okay, so this is a common practice, especially when a child is having a cold. You're in the habit of asking them to blow the nose, right? So ask your child not to blow the nose. Also, these nosebleeds are very common in dry weather, hot climates, also in winters when the humidity is low. So using a humidifier in the room will help sometimes. Also make sure the child or the adult is hydrated well. Drinking plenty of fluids will help. And another thing to be avoided, especially immediately after a nosebleed, don't force them to take very hot liquids. So this might again reinitiate a bleed. So avoid drinking hot fluids immediately after a bleed, especially for the next 12 hours. Now, if it is an adult patient, then check the medication. If they are on blood thinners, especially aspirin, clopidogrel are some of the blood thinners. So if they are taking blood thinners, so consult a doctor, because they may reduce the dose or they may ask you to stop it. Do not stop these blood thinners without the advice of a doctor. That's not recommended. So even after following all these measures, if the nosebleed is still persisting or if it is very recurrent, then you must consult a doctor, because they might check for any blood clotting problems or any kind of infection that is not settling down, might need a doctor's prescription. Hope this video was useful. Thank you for watching.